Hello, good afternoon from Finland. My name is Jaana Pylvänen. I come from Aino Health, and we are starting now this Aino Live number 2. It's the second session of ours. It's a live session, and I'm speaking from our Helsinki office, and my responsibilities are in Finnish market. So I'm working with the sales and marketing and partnerships, and I've been working with our health sector companies for almost 3 years now. And I have also here with me my colleague from our Stockholm office. So Malin, you can present yourself.
Yes, Malin Eriksson from Stockholm. I'm working as a customer success manager at Aino and a workability specialist. So it's going to be interesting 15 minutes for us, I think, Jana.
Yes, there's a lot of untapped potential in the healthcare sector and in the healthcare resourcing in particularly. So we are here to discuss about the healthcare resources and what can be done at the working place to secure the competent healthcare professional. We know that there are certain changes in the legal environment which can also have the impact, but we are not today for discussing on those topics at all. So we are focusing fully on what can be done in the working place, in the healthcare organizations. So the idea for this 15 minutes is that we go through a couple of statements and we elaborate our learnings both from Sweden and from Finland. So let's start from the first one. So citizens don't get healthcare because healthcare is suffering from lack of resources. That is absolutely true in Finland. So we are facing situations, for example, that operations like operations for patients cannot be done due to lack of competent healthcare professionals. That has been in the news even recently several times. And the situation was already quite bad before COVID-19, but now it is becoming critical. Critical for the patients and critical for the workplaces as well in the healthcare sector. How about Malin? How is the situation in Sweden?
Yeah, it's the same in Sweden. And according to the big trade union Kommunal, the healthcare crisis is a personal crisis. The staffing is not enough to staff the number of care places that would be needed. An example of this is the crisis in the emergency department. If there's a lack of staff in the hospital, which means that all care places in the hospital are not available, and there are not enough care places for those patients who are ready to be transferred from the emergency room, but still need to stay in the hospital. So the emergency department becomes overcrowded, and really sick and injured persons risk not receiving care caused by this. And then I can also tell that we have like this EVO in Sweden, the Inspector for Care and Social Care, and they showed in a report 2015, before the pandemic, that understaffing and difficulty in recruiting competent healthcare staff increase the risk of patients being misjudged, mistreated, or not receiving any treatment at all. And the lack of continuity increases the risk of malpractice, and high workload has resulted in patients receiving the wrong diagnosis and treatment or no treatment at all.
So we are facing a real problem, and I think we need to think about like different kind of solutions, how we can tackle the problem. I don't think that there is only one unique solution that can solve the whole resourcing challenge.
No.
So the second statement what we have is that healthcare professionals are looking for other opportunities. And as we know, and especially now after the pandemic, there is ongoing globally what we call great resignation. So the people are on the move. They are looking for, employees are looking for new opportunities. And that is also happening in the healthcare. Healthcare is facing that fact that healthcare professionals are looking for other opportunities than care job. So we are seeing that now more and more healthcare professionals educating themselves to totally new occupation, which is another in industry, not anymore in the healthcare sector at all. Is the situation same in Sweden?
Yes, it is. But mainly we also see that doctors and nurses are working for staffing companies in order to get higher salary, flexibility, and to be able to influence their work situation. And it's cost, of course, for the healthcare sector, both in terms of money and human resources. And And I read a study that show, or many studies that show that the use of staff nurses with short contracts can contribute to higher workload for the permanent staff, a worse safety climate, and less efficient working methods. And it also creates a downward spiral when staff leave, and the workload of those who remain at the hospitals increases, leading to a worse schedule with less flexibility and more overtime. And then we're going down and down. And I think we're quite down in this downward spiral right now.
Yes. So it's a pity that the healthcare sector is not that tempting anymore as a working place. So
Yeah.
what else do we have here? So what we state here is that the sick leave is highest in the healthcare sector. So
Yeah.
in Finland, in average, 22 days sick leave is the number on average in the healthcare professionals in the public side. So it's the highest in any industry in Finland. And it means that approximately 6 million working days are lost every year due to sick leaves. 6 million working days are missing from the working places because people are on sick leave. And in Aino, we have been studying that productivity topic for more than 20 years now. And what we have found out is that big part of this sick leave is not due to medical reasons. It's due to other problems in the working place, lack of engagement, lack of appreciation, lack of motivation, competence, and due to working conditions, but it can be like too much workload or high pressure like we all have faced now during pandemic. And the root cause for the sick leave can also be in leadership and also in internal and external environment. Think about people who have been working several years in pandemic environment in the healthcare, and now we are facing war, and there's coming like new kind of problems in the working place when we are facing also the people from Ukraine, for example.
So you mean, Jana, that we can see that these factors affect sick leave as well as can contribute to people leaving the healthcare sector or the public healthcare sector? I mean, it might be the
Absolutely.
same root causes.
Absolutely the same root causes. So I think it's first shown in the sick leave, in the kind of like because of the reduced engagement, and then
Yeah.
these people are ready to leave.
Mm.
And how about in Sweden? What we say is that there's average 27 days sick leave. So I think the situation is
Yeah.
not so good in Sweden
Even
either.
worse. No, it's not good at all. And I mean, it must be really important nowadays to do something about it because, I mean, it's a challenge to find the competent staff, and then it's difficult to retain them. So, what can the employers do in the public healthcare sector? It's a lot of good things that must be happen. But I can tell you that SKR, do you know what that is? The states, municipalities, and regions in Sweden. They, together with the labor market partners, developed a declaration of intent for healthy workplaces in the municipal and regional sector last year, at the end of last year. So they agreed that the employees are crucial to securing the quality of welfare. So that's good. And they also agreed that employees' health, commitment, and pride in their work are increased through investments in long-term healthy workplaces. So they are focusing now on healthy workplaces, focusing on research and development programs for health factors in order to increase knowledge about this at the different departments. So they want to work more proactively, and it will be really nice to see how this will affect the public health sector.
Yes, that's very interesting because we also like the next statement is that the healthcare professionals lack this internal appreciation for the work. So during the summer, there was published a research report that Finnish citizens, so us as patients, we appreciate the healthcare professionals very highly. We are appreciating to top 5 professions in Finland.
Mm.
So that comes down to the question of internal, it must be the lack of internal appreciation. Do you know
Yeah.
what it means?
No, what do you mean? I think, but
Yeah.
explain, please.
So kind of like what we tend to think that it's something that we just say thank you, that we appreciate your work, but it's something that happens in the everyday life in the working places. So healthcare professionals should also be able to participate to develop their own work.
Mm.
So it means that you are listened to as a professional and you can influence to your working life. So working conditions and how the work is organized.
Yeah.
So that helps you to be able to perform your work well. So it's also this appreciation is about giving opportunity to training,
Yeah.
to influence to your working times. Of course, it's also seen as a decent salary and incentives.
Mm.
So this kind of like a psychological safety and your leaders kind of like participation into your everyday life is important,
Yeah.
kind of like a proof of this kind of like internal appreciation.
Mm. So,
Mm,
so to correspond, I think, to the declaration from SKR and the parties that I mentioned. And I can also add that they stated that a good dialogue between employers and employees is a healthy factor itself. And it's an
absolutely.
important
Yes.
part of the work environment work.
Mm. And that's the next statement. What we also have here is this top management prioritization should have that they focus on having competent leaders, because also healthcare sector is lacking competent leaders and also the time for the proactive work, meaning that when you nominate the leaders in the healthcare sector, they should be motivated in being leaders. And
Mm.
also what you need to dedicate time, that you have time to speak with your employees and know what is happening there. So in Finland, we are now about to start new health reform areas next year, and we will
Okay.
have a lot of employees in each of them. And,
Yeah.
and, and these resourcing problems will escalate if we don't have this top management prioritization in place, where we secure that these immediate leaders are proactive in the working place.
Yeah. Uh, because I mean, a lack of time will be a problem, or will be seen as a problem for the managers.
Exactly. And that's something that you have to just dedicate from the top management point of view, that there must be time for this kind of work, that the
Mm.
leaders are available for the employees.
Yeah.
So the last statement what we have here is that uh, preventative actions are a business case for the healthcare sector. So what we have calculated based on the pension company's numbers about the sick leave, but also kind of like our experience, that if you would be able to prevent only sick leave part in the healthcare, maybe one third, or you could even go down to half of the existing numbers, you could save 1 to 3 million working days. And that means that you would have yearly 11,000 more resources working full time for the healthcare sector. So it's really a business case to make this proactive work to part of the everyday life.
Sounds like a solution for the problem. I mean, to work proactively, and to be able to focus on the employees. Uh, but I guess also we can see that make a difference. If you want to work proactive, you must find the root causes and take measures
Mm.
for improvements. Isn't it
Abs-
so?
Yes, yes, absolutely. So I think what is important is that you make this a systematic. And if you have bigger organizations, you need to have digital tools that you can follow. You have
Mm,
triggers, when to have these proactive discussions, and to make it systematic, then equal for all the employees. And you as a kind of like manager for or leader for a big healthcare organization, you should have a dashboard where you can see that how is this going in different parts of the organization, that are leaders doing their work, which is
yeah,
securing that the employees feel that they appreciate it and they have their working conditions right.
yeah,
Of course, it shift feels to be very big, from the existing, that we have a lot of like burning problems in the healthcare, but it requires this kind of like decisive method to change from being reactive to proactive and make it systematic, and also have the tools to support that.
Sounds real good. And we know a lot of it. So if you want to know more about this, please contact us. You can find us at the social medias or the website.
Thank you, everyone. It was nice 15 minutes to discuss about the situation in Sweden and Finland, and we are sharing the similar problems. So that's why we are also sharing our experiences here,
Yeah.
and inside I know, of course, as well.
So thank you.